So I'm going to start with a quote from a local resident. I do believe it's like garlic bread, it is the future. And I guess just taking a step back, if we think about what the point of integrated care systems are, they're about partnerships, coming together to take shared responsibility, to take collective action on things that improve the health and well-being of the local population. Population health management is the way to do that. It's the way to do business for the future, I guess. It's about looking at data to drive decision making so that people get the right support, the right care at the right time for them. The PHM development programme was a 20-week, it still is a 20-week, intensive, I guess, accelerator approach to how we can start to embed the right capabilities within systems. It's been a real learning curve for us nationally as well as the system locally. And actually I think what we've seen is that rather than developing capability, what we've been able to do is support people locally to release the capability that's already in systems, but also to release the capacity to start to utilise the amazing public health people, the clinicians, the business intelligence and analysts that are available, who have amazing skills, put them all together to be able to actually look at what are the things that will make a difference to local people and start to actually make that change on the ground in terms of the care and support that is provided. Some great examples, such as the data that's available for people who have assistance with their wheelie bins, really helpful in thinking about who might be vulnerable that we don't know about. Some of the data that's been used around houses of multiple occupation and some of the ill health risks that come with that. Some of the examples around litter pickers, voluntary people who go around trying to make the place a tidier place and starting to spot things like people curtains not being open at lunchtime, etc. I think those are just great examples of how people are thinking about things differently and taking the opportunity to think much more broadly about the totality of public sector, but also all of the assets, in particular the local communities themselves. So we've seen in the long-term plan population health management as it's littered throughout the plan actually in terms of expectations about how we start to change how we do business in the NHS. But I think more broadly within the long-term plan, the expectation that integrated care systems, of which all systems across the country are expected to become by April 21, that it will be almost the sort of foundation for things, for how things are done within integrated care systems. There's also the GP contract, and population health management was heavily mentioned within that, as well as the primary care network, DES, and the expectation that groups of practices come together and utilise the data on their local population to actually make a difference to their care and support. And I guess really emphasising what the point of primary care networks are about improving population health at that level.